My story began with a death sentence.
My beginning is before AIDS.
She talked about this new disease. It was going to change the face of medicine in South Africa.
Very few of us had any understanding of the epidemic.
Really, I had absolute, complete faith in the fact that, science would prevail.
When the epidemic first came, I thought it really didn't concern us. It was a problem of white gay males in California, and that was a dreadful mistake because, as you've seen, from the 80s, we've become the worst affected country in the entire world.
We had HIV. We didn't have the drugs at that stage.
The drugs haven't arrived.
Who could afford to be on the antiretrovirals? And you were talking about $10,000 a year.
Yeah.
We had this real view that there was new hope. I think we were all a bit patient. We were saying, Mbeki comes to power and we need to allow him a bit of time to bed down. Same was true for Mantu.
What I kept hearing was, you wanted a policy on treatment, you've got it.
Some of the memories I have is of a lot of people dying, a lot of friends dying, personal confrontations that I had which were unpleasant with the former Minister of Health.
It was already known that the infection in children can be prevented, and yet they were still dragging off feet.
There was a bit of conflation of the issues. We then got into a bit of a debate which polarized us as a country.
As we grew, AIDS denialism hardened. As it hardened, we had to fight it harder. As we fought it harder, Thabo Mbeki, being a proud and arrogant man, hardened his position further, and unfortunately we got into a kind of, I think, vicious spiral.
There were very few people who supported us fighting Thabo Mbeki. And within the government itself, if there is a handful I can think of who stood up, it's a lot.
From an international perspective, we were embarrassed.
Bearing in mind that it's always been the case that an effective response will have to be a national response.
What moved and inspired and motivated you in those days was the personal interactions with people.
I think it's right to capture this history.
Well, I'm a public health physician and in fact do not treat patients. My first encounter with HIV and AIDS was reading about it in the US, and that was in the early 80s. I think it was in 1984, 1985, when mention was made, when I read in fact in the articles about the HTLV3 virus that was that seemed to be causing in fact a major problem in fact among gay men. But of course at that stage it was just getting to know about a disease that seems to be new, that few people knew much about, and it didn't seem to pose a much greater threat. But with time it emerged that this disease was sexually transmitted. And of course, being sexually transmitted, it began to show itself in the heterosexual population. And that's when it became apparent that this poses a potential threat to South Africa as well. In the early 80s, I think it was 83, 84, also there were some reports of gay men in South Africa also having been identified as having HIV and AIDS. HIV, it was not AIDS, sorry, HIV at that stage. And because disease knows no boundaries, even though at the time there were very rigid controls of relationships between black and white, and as well as in fact the gay community were not in fact fairly open out there. It became evident that this was going to be a healthcare problem for the general population. And that's when my interest got in fact heightened. As I said, being a public health physician, my concern and my interest tend to be on those threats to society, those threats that affect populations. My interest is on how to prevent them at an early stage before they start setting in, because to control a condition that has already got into the population becomes a problem. And this is how I got introduced into HIV and AIDS. And of course, in 1985, I recall the seroprevalence surveys that used to be done by the Department of Health. Of course, the format was different from the current ones that is taking place. Did indicate at the stage that HIV prevalence among Africans was pretty, in fact, fairly, very low. Later on, in fact, it was non-existent, it was close to zero. And later on, in the late 80s, 89s or so, it started showing up. Prevalence, in fact, of HIV started showing up. And that's when it became evident that the problem, HIV as a problem, was already, in fact, set in South Africa, and all had to be done to really, in fact, combat this disease. Obviously, in fact, a disease of that kind that is sexually related has a bearing on, in fact, the products of sexual relationship, which is, in fact, children. It has got an effect also on the stigma and, in fact, how people relate to one another. We know very clearly how sexually transmitted infections like syphilis and other STIs, how these are viewed in society. So evidently, it was clear that apart from the spread of the disease, we are going to see children being involved, being affected, even though they may not have, in fact, have any say in the disease that is transmission to the children, but also that we are going to see increasing levels of discrimination, increasing levels of a negative response to those who have, in fact, this particular condition here. And yes, indeed, in fact, this is what happened. HIV and AIDS gave rise to one of the very nasty side of mankind, which really, in fact, culminated in the late 90s with the death of some of, in fact, the HIV-infected persons, because of, in my belief, because of the fear that people have, because of the prejudice that people have towards, in fact, those that are HIV-infected. Fear of the unknown and, in fact, the prejudice that exists towards those who have the disease. I think what stands out very clearly is that when sounding warnings of the impending danger to people who do not see it, who cannot, in fact, experience, who do not experience that danger and cannot see it, in fact, right of hand, often does not yield any positive responses. There was a lot, and I was not the only one. I think there was a lot of efforts that were made. There were lots of efforts that were made by a number of people on education. But that education did not really take off ground. And of course, the education did not address the underlying factors that were fueling, that were bound to fuel the epidemic. So that stood out very, very clearly. At the time, our focus and attention was largely on the so-called high-risk population. But we knew quite well that it would not stay for too long in the high-risk population. It was bound to spill over into the general population because of, in fact, the relationships that people have across, in fact, the sexual preferences. In 1994, okay, perhaps, in fact, even before Narcosa, maybe one thing that I can mention is that as a result of the emerging negative attitude that was beginning to show itself among the general population towards people who are HIV infected. There were lots of initiatives by a number of people, by a number of organizations, particularly the non-governmental organizations, as well as those that were playing a part towards the development of the new world order, the new South African order, that is the Law Commission in particular, South African Law Commission, which established, among the other commissions that were established, it established what is called the Project Committee on HIV and AIDS, in which I served. Yeah, our project, I think it was number 85. In fact, I served in that project together with, in fact, Judge Edwin Cameron and a number of people as well that were working in it. So that was one of the indication that there is a need to prepare for the country to prepare itself and ensure that the groundwork, the legislation, as well as understanding, as well as, in fact, the general population is made to understand the issues that relate to, that affect, that HIV and AIDS does affect in society, a whole host of factors, and in fact, some degree of regulation and some degree of guidelines on how people, how to respond to, in fact, the epidemic, and how to respond to people who are HIV infected in society should be. So that was, in fact, the effort that came out from, as I said, in fact, in this case, it was South African, the Law Commission, South African Law Commission. With regards to NACOSA was a good conglomeration. You asked about NACOSA. It was a conglomeration of a National AIDS Convention of South Africa, and there were a large number of participants in the process. Participants which range from a variety of non-governmental organizations, academic institutions, research institutions, as well as, in fact, just concerned citizens and other organizational structures. All of them aimed at trying to push the message and to get an appropriate response to, in fact, the epidemic. And I think that in a nutshell, really, in fact, that's it. So NACOSA was mainly the collective effort of all those who had concern about the rising epidemic in an environment that was very rife and very suitable for the epidemic to go out of hand. And that was basically, in fact, what transpired. NACOSA played a significant role in providing the seeds and the ground work for information that led to the establishment of stronger organizations that have emerged as, in fact, major activists now, and that have advanced the agenda for HIV and AIDS far much more in this country, far much more than any other. And I think, in fact, those were the beginnings, in fact, of the response to the epidemic. I think, as I said again, in fact, my area of interest and my area of concern is always prevention. Is always prevention, and I am not in the clinical discipline. And I think, in fact, prevention of transmission of disease was one thing. Prevention of, again, the negative social response to the disease. Those were the areas, in fact, of focus that I have been actively involved in. But also, in order to really advance this, it's important to monitor very closely. It was important to monitor very closely how the epidemic was progressing in society, so that the efforts for prevention are targeted at the right sector of the population. Of course, initially, as I said, it was mainly the high-risk population, but the high-risk population, and being mainly, in fact, the youth, and in fact, school-going kids, as well as, in fact, people with, in fact, high-risk behavior. But of course, in fact, with time, it became evident that the general population needed to be targeted, and it could not no longer target, in fact, specific sectors of the population. My area of focus was health education, primarily among the school kids. And then to that end, I have taken part in the early 90s in writing a number of booklets that have been used in the schools, or at least that were intended to be used in the schools. These have been taken up and used in Botswana and Swaziland, in South Africa, before they could really, in fact, take off the ground. This newer, or at least a different decision was arrived at to, in fact, establish some communication that would be different, that would be separate on HIV and AIDS. And the publisher, Macmillan Boleswa, was the one that published, in fact, a number of the booklets. I cannot recall how many that I wrote specifically on this. And in fact, as I said, for a number of years, I don't know what the situation is now, but for a number of years, both Botswana and Swaziland, in fact, were using those. And South Africa was earmarked to be part of that, but they never took off ground. There were booklets that were written in simple language, some aimed at, in fact, lower primary, as we call them, lower primary school kids, very young kids, and therefore the messages were written in very simple language, and in fact, just to explain what, the healthy behavior and what HIV is, what the risks of HIV is, or rather what the causes of HIV are, and how to go about in preventing, in avoiding to get infection. So there was one that was aimed at, in fact, primary school kids. Another was aimed at slightly older children, in fact, and that had a little bit more detailed information. Of course, it contained also information about sexuality and growth and maturation, sexual maturation. That is the older one. And then there was a booklet that was aimed at the teachers for, in fact, the young kids. Another aimed at the teachers for older kids. All of them aimed at enabling them, in fact, to assist, communicate, and in fact, to explain further certain concepts that the youth, in fact, may not be able to comprehend. As you can imagine, to succeed, one cannot do prevention, in fact, out in the corner, and in fact, in a particular corner of, in fact, the country. It's absolutely essential to succeed, for success, to ensure that there is going to be participation of the government. Government is, in fact, the key and the central player in the whole host of, in fact, preventive programs. And government services, in any case, also have got a greater level of access to the population than, in fact, any other services. So my entry point was to get in through the government health services, and in fact, the primary health care in particular, that is the primary health care facilities, which are clinics. But to get through to the primary health care, one had to ensure that there is support and agreement of what one is doing by those who are policy decision makers, who influence and who decide on what gets done at the primary care level. And to that end, I got involved, in fact, at the provincial level as well. And on a few instances, there was also involvement, in fact, in the later stages, perhaps, rather, let's put it that way. In the later stages, I got involved as well at the national level with, in fact, the HIV and AIDS planning program. You mean for involvement at the national level? It was 19, I think it was 1980, 1990, well, I'm not certain, but the first, I think, what do you call it? SANEC, the SANEC meeting? Yes, yeah, the first SANEC meeting, yeah. I was involved, in fact, I wrote in fact, in SANEC, in the monitoring and evaluation team of SANEC. It was after that SANEC was established that, in fact, later on, the committees that were established at the SANEC involved started pulling in. I was not part of the SANEC. SANEC, in fact, consisted of the political leadership, and as well as, in fact, people higher up. But I was serving in a committee, in one of the committees that was, in fact, reporting. So the monitoring and evaluation committee was the one that I did serve in, but it was, albeit it was for a short period of time, and because of constraints of work commitments, I could not continue serving in it, in fact, for a very long time. I served, I think, for just over a year, and then, in fact, I had to ask to be relieved. I think the biggest challenge is first to get, at the community level, is to get the level of understanding, in other words, to get down to the level of community, to a point where one gets understood very effectively and get the support by, in fact, the local community. But my entry point, as I said, was through the primary healthcare facilities. That made it relatively easier for me because these are already manned by healthcare professionals, and therefore getting through them and working through them was relatively easy. And of course, there are also NGOs. Later on, there were NGOs that were involved, and by virtue of the fact that they were working in the field, they were interested in the field, it was relatively easy to work with them and, in fact, to be understood by them, because to have a technical input at that level, it makes it relatively easy, in fact, if one can talk the same language and be understood, in fact, by the community to the same extent. But also, the other issue is coming from outside. It is not easy. Whenever one gets into any community, coming from outside, it's not easy to understand the challenges that an individual community may be experiencing, and therefore I had to rely very much on the people on the ground, people that are working, in fact, in the field, to be able to make my input. I always believe that I cannot make a contribution, I cannot alone bring about a change, but I can contribute my inputs to the collective work that is being done by the group towards a change. That was, in fact, at the community level. At the provincial level, it was just adding my technical inputs. I served in the Gauteng AIDS Council for a number of years. It was adding, in fact, my technical input in the committee that was working, in fact, on the Gauteng Provincial AIDS Council there. And at the national level, it was also technical level, but in a narrow field of monitoring and evaluation. And that's basically how I got involved at all those different levels. The challenges are immense. Of course, first, there has to be, you've got to be able to convince people about the importance of, in fact, of what one is doing. And there is a wide range of interests, in fact. Remember, HIV and AIDS touches on the whole host of things. HIV and AIDS, by virtue of the fact that its arrival brought with it a number of quite substantial sponsorship, and therefore clamoring for all sorts of, in fact, funding opportunities. The potential levels of, in fact, friction arose from, in fact, the various participants. So, in working on such a thing, conflict is bound to be, in fact, or rather differences of opinion, which often leads to conflict, tend to be, in fact, a common finding. At the community level, I must say, I really did not experience that all that much, because I was not directly involved with the individual communities. I was working with primary health care, and in fact, all I had, in fact, was just support and nothing else. At the provincial level, again, the disease, the condition, HIV is not just a disease. It really affects a wide range of social fabric of society, with the result that when one deals with it, when one tries to develop a strategy, that strategy to be effective has to spread across and affect and be involved the participation of the various role players with different types of skills. And the challenge that comes is, in fact, by virtue of the fact that the paradigm of the different role players may tend to be different. In designing as particularly preventive strategies, there are bound to be areas of tension, there are bound to be areas of, in fact, disagreements, and that's a common challenge that one experienced, especially, in fact, at the level of province. But of all the challenges, there is no greater challenge than, in fact, the lack of resources and, in fact, lack of support from the top leadership. At some stage, I think it's common knowledge that, in fact, at some stage, we believed very strongly that, well, preventive programs alone are the way to go for, in fact, for combating the infection. At the time, the pandemic was already here, and in fact a large sector of the population was already affected. It was already known that ARVs do bring about a change. They can increase the life expectancy of those affected. It was already known that the infection in children can be prevented, and yet they were still dragging off feet. Remember, prevention is not just prevention of infection, it's prevention also of death from, in fact, from occurring among those that are already infected. So that part was a major challenge because, in fact, it really rests in the powers that are higher, in fact, to make decisions of that kind. And when it is evident that mortality or the deaths of people continue to rise, and there's very little that is being done and that can be done, except to bring about the treatment, either to bring about the treatment, in fact, that would then reduce mortality, at least in some, not necessarily in all. Then it becomes a significant challenge. The third element also that became a major challenge, and I'm pleased to say that the situation has changed significantly, and thanks to the minister, the current minister, for the fight that he has fought, and he's not the only one, by the way. And I think, in fact, credit must be given to all the activists that have been fighting the battle to really get affordable medication. And that was a frustrating thing, because what it meant in the past was HIV treatment and HIV cure was only for the rich, could only be afforded by the rich. And therefore, prevention of loss of life could only be, in fact, something that the rich have access to, and the poor were doomed to death. It's common knowledge that, in fact, up until very late recently, government was very, in fact, reluctant in pursuing that direction. Yes, ultimately the decision was made in the mid 2000. I think it was in 2004. So no, much later than that. Ultimately, the decision was made to allow for ARVs to be utilized. But again, the threshold was set at such a high level. The threshold to qualify for ARVs was set at such a high level. The conditions for providing ARVs also were such that they inevitably meant that very few people would be put on ARVs. It could be argued that, well, at the time the cost was prohibitive. The cost of treatment was prohibitive. But that was not because of the cost that decision was made. And that decision was really, in fact, it has had a significant impact in really slowing down an appropriate response to the epidemic. Yes, preventive programs through education in the schools, through education that was allowed, in fact, funding the organizations like the Love Lives, that went on. But when you already have the high prevalence of a disease in a population, what it means is there's a large percentage of the population that is infected, that is propagating and transmitting the disease. Education alone will not be able to contain that disease. What you do need is, in fact, reduce the percentage of those that are infected, the percentage of those that are infective, so that at least you get fewer and fewer infections. I was actually, in fact, I was part of the organizing committee for, in fact, the AIDS 2000. We, together with, in fact, Jerry Kuvadia, Slim Karim, and, in fact, Mary Crew, and, in fact, others, we were in the local organizing committee of, in fact, that particular AIDS conference. I must say it was a watershed conference in many respects. A watershed conference in the sense that, one, it was the first one in the African soil, a very huge, in fact, conference that South Africa had to host. Watershed in the sense that it really highlighted, it did bring about a sharp focus on the epidemic, on the government's response to the epidemic, and not only in South Africa but globally. And the third element was also, in fact, I think it was the petition that was signed by all the scientists, in fact, the world over, and in fact those who came. And the declaration, yes, not petition, yeah, the declaration. That declaration, which in fact we signed, it really carried a message, a very strong message, that civil society the world over really deplores the approach that was taking place of believing that, in fact, there is an alternative cause of HIV, that, in fact, the Duisberg approach, that, in fact, that type of HIV and AIDS is really, in fact, not the cause of death, but in fact it could be something else. Not when there was ample evidence and, in fact, substantial scientific evidence the world over that it was, in fact, a specific virus that was responsible for knocking the immunity and therefore allowing the variety of diseases, in fact, to take over. And I think that particular conference brought into sharp focus that particular message. It also helped in bringing about all the forces that were striving for a greater recognition of HIV virus as a cause of disease and an appropriate response. It brought everyone, in fact, together and, in fact, strengthened the arm of, in fact, what we later now got to know as, in fact, this what do you call it? The active, the activists, in fact, that have given rise to, in fact, the fight for HIV and AIDS. The Mark Haywood, in fact, efforts, in fact, that have ultimately driven towards much greater acceptance, a much greater, in fact, acceptance of government of, in fact, a comprehensive approach towards HIV and AIDS epidemic. Well, I think, in fact, it's human nature, really, in fact, to try and think of something that is less threatening. I mean, the thought that HIV and AIDS could really be, in fact, the cause, and that we do not have an answer, that it is transmitted, in fact, through sexually transmitted infection, is enough threat, is enough to make anyone really feel that, look, perhaps there is, in fact, some other reason. And when you get a person like when you get, in fact, a fairly prominent person like Duisberg coming, in fact, with a view that seemed to suggest that it may not be a virus, is very easy for a person who is not, in fact, a scientist to really, in fact, latch on to that. But I would hate to guess what could be the reason why the leadership in the country, in fact, believed that. I wouldn't like to guess. But one thing that is common knowledge is the response in any country tends to really be guided largely by the response of the leadership at the top. And you asked me a question, why do you think, in fact, that was the case? The problem arose because, in fact, at the top in the country, that was, in fact, the view, and policy decision makers and all the people really that could have rallied around government could not go further when, in fact, the decision at the top was vacillating, in fact, in that sense. Certainly among the healthcare workers, I haven't encountered anyone who really, in fact, believed that. But in the general population, I think that for quite a while, and I wouldn't be surprised if even now there are still people who believe that. Those who want to justify the lack of interest to change the lifestyle tend to, in fact, argue that that is, in fact, not the case. But also in the perception that, look, the traditional medicines, in fact, can also, the traditional healers are able to really, in fact, bring about. There are lots of people who believe in fact, what can I call, some who would like to believe in those aspects which are not backed up by fact or science, and among these there's lots of beliefs that I'm sure you must have heard about, lots of beliefs that are often bandied around that, in fact, sleeping with a virgin would make one, in fact, to be free of HIV virus. I think you'll never run short of people who have got deviant thoughts, who would like to justify whatever actions they are doing, or who would like to believe that to change what they are currently, the behavior they are currently manifesting, would not be, in fact, in their interest. They will find any reason, in fact, not to give that. But I have never, among the healthcare workers, experienced, even at the primary healthcare level, experienced anyone who believed that, in fact, HIV and AIDS is not the cause of HIV is not the cause of in fact, the disease. Yeah, the problem about, in fact, those type of statements is they create doubt, and in those who already are reluctant to accept the fact, it becomes fertile ground for them to accept and say, well, look, this is, in fact, not the case. So it is important that the message that comes from anyone in leadership position or anyone who has got access to the media, that they, and in fact can influence the population, that the message that comes out is a message that does not create, or at least that does not create further element of doubt that is unfounded, and in so doing, finding fertile ground in those that have already, in fact, some queries. Well, I'll take you to the conference, the AIDS conference in 2000, and in fact, what transpired in the very first, in the opening ceremony of, in fact, that conference. And I think, that to me stood out very, very prominently. And in fact, if I recall very clearly, there are a few things, in fact, few steps that one could take and say, well, look, in that day, Nkosi Johnson, in fact, stood out in front of, in fact, the audience when the whole world was actually, in fact, watching. In that state of health, one, he was a child. Two, in that state of health, really, in fact, anyone who could not be moved must have been in fact, I can't imagine, in fact, what type of a person that would be. But when it became apparent that, in spite of the fact that there was such an outcry, really, in fact, to respond to that, in fact, epidemic, that here was, in fact, a child signifying the number of people and number of children that are affected, who are innocent, by the way, who really happen to be caught in the crossfire. That in spite of that, there was very little, in fact, movement, little response to that. It really, in fact, was frustrating. It was very frustrating because nothing else could be done. I couldn't imagine anything else that could be done that could make the powers that be to change their minds. If no one could be moved by that, not only the large crowd of people that really, in fact, and they were presenting, in fact, scientific facts, by the way, and in fact, all the scientific evidence. And here was also, in fact, a child as well, in that state of mind, making an appeal to the global community, an appeal that fell on deaf ears. And that to me was, in fact, pretty frustrating. I think it will not serve much purpose really to say about how many lives have we lost as a result of not responding in time. I think it's good to say that ultimately there has been, in fact, a positive response, and that response has brought about a very, very, in fact, fascinating outcomes. We now have the prevalence among, in fact, newborns that is very, very low, and in fact, we are going to have generation of children born of HIV positive mothers who are going to be free of the disease. That to me is, in fact, the exciting part. Really to focus on how many lives we have lost as a result of not acting in time, I don't think, in fact, that is going to help us. Well, that victory is really, in fact, it augurs well for the country. There was a time when we looked at the costs of providing treatment, and the fact that a fairly substantial percentage of the cost really, in fact, came from PEPFAR. Government was plowing quite a bit of money, but in fact it was also being assisted to a large extent by PEPFAR. When we looked at the figures there, it was evident that it was not going to be sustainable. It was not going to be sustainable. However, the persistence of, in fact, the civil society organizations in particular, especially, in fact, those that were driving the process, and I think, in fact, the changeover in government to the current leadership, those have made a significant impact, and in fact, the pharmaceutical industry have ultimately, well, they did initially, in fact, make some inputs, in fact, and some suggestions, but the significant change that have taken place with the reduction of the prices, in fact, the drug prices, have brought about delight, I can say, and in fact, we can look at the life expectancy improving. We can look at, in fact, people having hope of, in fact, survival who did not have hope. We can look at children who can see their mothers and fathers, in fact, growing a little bit older when they could have, in fact, died at an earlier stage. And I think all of that really, in fact, we need to hold our heads and take our heads off to the activist group. We need to take our heads off to the current leadership. We need to take our heads off to the civil society that did not let off even when times were hard, even when it was evident that, in fact, the pharmaceutical industry was, in fact, so powerful and, in fact, very non-relenting on, in fact, the cost of treatment. We hope that in future we will get, in fact, the prices to drop even further. It's difficult to say. You can't, in fact, prescribe the behavior that individuals should make in the face of a threat. You are saying quite rightly, why didn't they challenge? When you challenge, in fact, powerful forces, you can expect a reaction. And the reaction, if you are not strong enough, if you don't have, in fact, a strong backing, if you don't have there's something to fall back on, might, it may in fact be enough to annihilate you. So to hold it, we can't hold it against those who may not have acted, who did not in fact show up the level of action that the others did. I think in fact one needs to always think of the circumstance of an individual circumstance of in fact individual organizations to say, well, can they and would they be in a position in fact to sustain that? Yeah, I think it's we need to take cognizance of the individual circumstances, the circumstance of the organization, that if it is an organization, and accept that we are not all in a position to launch the challenge that in fact is necessary, and some people are able to do that because of the platform that they do have. Others may not have in fact that platform, and I think in fact it's in the same way as in the early fight against in fact apartheid. We could argue that in fact why is it that some did not take the arms in fact and just set in? They had their own battle as well. Yes, there are those who fought and in fact fought with their lives, those who lost their lives, but the truth of the matter is that in fact some were fighting battles within here in fact in a different form. So we need to take cognizance of, in fact, the individual circumstances. As I said earlier on, my contribution has always been part of the team, and in fact, adding on the technical know-how on certain aspects of, in fact, prevention, as well as, in fact, in education, and in fact, educating both, in fact, the young generation, which is, in fact, within the institutions that I work in and in fact outside. So my contribution, I would say, it has been largely really in fact I would like to believe that I added a view, I added in fact technical know-how in those organizations that I've been part of. Well, I think I can say that we certainly lost in fact the wrong perceptions in fact that prevailed at the beginning of in fact the pandemic in this country, which is a good thing. We have lost in fact something bad. We have gained something good. But we have lost lives. We have lost lives that could have been saved. We have lost an opportunity to have lower levels of prevention than the lower levels of of the disease, of prevalence rather, of the disease. Through prevention, and that is something that we really have to work hard on to see in fact what can be gained. It's not going to be an easy task. It's going to be quite a mammoth of a task for a long period of time. Well, I think as Prof. Karim had indicated, really what it means is it creates an opportunity to understand better those elements that could lead to a prevention of the disease in future. It does not in itself mean that in fact we should slow down on the interventions that are known to be very effective. There are a large number of interventions, preventive interventions that are known to be very effective. Circumcision, male circumcision, the use of condom, and in fact, pre-exposure, what do you call, mother-to-child transmission prevention, as well as in fact, and as others. There are a variety of in fact, intervention strategies that are known and have been proven to be very effective, and we need to pursue that. As well as the behavior, we need to continue pursuing the behavior and the lifestyles that are known to be protective and preventive, in fact, against HIV and AIDS. This is the excitement that ideally, I do understand why Prof. Karim wants to share it, in fact, with the rest of the world. but some people would think that, in fact, no, we are going to have a vaccine in the very near future. That is not the case. We shouldn't, in fact, fool ourselves and think about that. But if it turns out that there is more information, valuable information that we can learn out of that, that there would be newer proteins, that antibodies that can then, in fact, be manipulated, that could otherwise serve as vaccines in the future, it augurs well for generations to come. Well, I see as a country that is less fearful of the pandemic, that has got some understanding that we can actually, in fact, overcome, and I see willingness on the part of role players, government, civil society, as well as, in fact, the private sector. I see willingness to come to the party.